Hello everyone, my name is David Anadi Perpula and I am presenting on ethical and legal decision making in end of life care. This presentation focuses on navigating family conflict and medical decision making in complex end of life scenarios. We will explore how ethical principles and legal frameworks influence decision making in cases involving family disagreements and life support. Additionally, we will discuss how to ensure ethical integrity by promoting clear communication among healthcare teams, families, and interdisciplinary professionals. Ethics consultation play a critical role in resolving conflicts and ensuring decisions reflect the patient's best interest. This presentation is a part of my course, Legal and Ethical Principles in Healthcare, at Grand Canyon University under the guidance of Professor Dr. Lashendra Span. This is the contents. This slide provides an overview of the presentation. It outlines the key topics we will address, ranging from medical care issues to the legal and ethical frameworks guiding decision making. We will explore how Arizona's law, family conflicts, and ethical principles intersect in this difficult case, and how healthcare professionals can navigate these challenges while respecting the patient's best interest. Each section is designed to build on the previous one, helping us to understand the complexity of making end of life decisions in hospital setting. Introduction to the patient. A patient overview. A 45-year-old patient suffering from a severe brain damage after a car accident. Current status intubated but not yet brain dead according to Arizona law. Family dynamics. Half of the family believes the patient wouldn't want to live this way. The other half accuses them of wanting to kill the patient. Allegations regarding inheritance further complicate the decision making. Challenges. Managing family conflict while respecting patients' wishes in a legally complex situation. This situation brings up a tough ethical and legal challenge for all of us involved in healthcare. As a hospital administrator, it's my responsibility to navigate through family conflicts, medical decisions, and Arizona state law on brain death and life support. It's not just about making medical choices, it's about ensuring patient wishes are respected while managing disagreements among family members and adhering to the law. It's a delicate balance, and we need to approach it thoughtfully to make the best decisions for the patient and the family. Medical care issues, critical care considerations, intubation and potential for life support, brain death criteria. The patient does not meet the criteria for complete brain death, family disagreements, differing opinions on the continuation of life support, importance of healthcare proxies and advanced directives. In situations like these, healthcare proxies and advanced directives are essential to guide the decision making process. However, in the absence of these documents, the healthcare professionals must navigate conflicting family wishes and legal requirements. And the Arizona law defines brain death by specific medical criteria. However, in this case, the patient does not meet those criteria, which complicates the decision making process regarding continuing life support or transitioning to comfort care. Arizona State Law 41107, the determination of death and the status rules. Legal criteria for determining the death in Arizona. How this law impacts the decision making of patients with brain damage. The key points are death must be determined based on medical standards. Legal guidelines for the determination of death in patients who are unconscious or unresponsive. Ethical challenges in end of life care are autonomy. The patient has a right to make decisions about their care. Beneficence, acting in the patient's best interest while managing life sustaining treatments. Non maleficence, avoiding harm by considering the potential suffering caused by the prolonged life support. Justice, fair allocation of medical resources in a family conflict. End of life care is filled with ethical dilemmas. In this case, family conflicts are exacerbating the complexity of making decisions about whether to continue life support, particularly when the patient cannot express their wishes directly. The role of family in decision making. Family dynamics, divided opinions on continuing life support, healthcare proxy. The role of family members or proxies when the patient is unable to communicate their wishes. Advanced directives. The importance of having clear directives to prevent family disagreements. When patients are unable to make decisions, the family members or healthcare proxies must make decisions on their behalf. In this case, the lack of clarity in patients' wishes create a difficult situation for the family and the healthcare team. Legal and ethical principles for family conflicts, informed consent and family disputes, managing conflicts where family members disagree on medical decisions. The role of committees, how ethics committee can mediate disputes and guide decisions. The role of physicians, ensuring that decisions align with the patient's presumed wishes. Family conflicts about life support require careful management. Ethics committees and physicians must facilitate discussions to ensure the patient's presumed wishes are respected and that medical decisions align with ethical and legal standards. The principles of autonomy in decision making. The respect for autonomy. The importance of respecting the patient's rights to self determination. Challenges when the patient cannot communicate when advanced directives or health proxies are unavailable. Balancing family preferences and legal guidelines. Autonomy remains a critical principle in medical decision making. However, when the patient cannot communicate their wishes, the responsibility shifts to family members or healthcare proxies, complicating the decision making process. Supporting ethical integrity in hospital. Healthcare teams' roles ensures ensuring open communication with family and medical staff. Ethics consultation involving interdisciplinary teams in decision making. Managing emotional and cultural tensions, addressing the cultural and emotional factors influencing family decisions. Ensuring ethical integrity requires clear communication among the healthcare team, family members, and interdisciplinary professionals. Ethics consultation can be invaluable in resolving conflicts and ensuring the decisions are made with the patient's best interest at heart. The role of advanced directives and healthcare proxies. Advanced directives documents that outline a patient's wishes for life-sustaining treatment. Healthcare proxies, the legal authority granted to a designated person to make decisions for patient when they are unable to do so. Legal implications, how advanced directives and proxies can help resolve family conflicts. Advanced directives and healthcare proxies are critical in guiding decisions when patients cannot express their preferences. In the absence of these, the family must step in, often leading to disputes, as seen in this case, Arizona State Legislature. Ethical and legal decision making process. Decision making framework, ensuring decisions align with ethical principles and legal guidelines. Engaging the family, involving family members in decisions while mediating conflicting opinions. Ethical consultations, how consultations can assist in resolving conflicts and ensuring fair decision making. The decision making process must be guided by both ethical principles and legal framework. In situations where family disagreements persist, engaging ethics committees and legal advisory can help mediate conflicts and ensure a just resolution. Supporting resources and tools. Medical literature. Understanding the legal and ethical aspects of end of life care. Ethics committees. Providing a neutral and unbiased guidance in decision making. Psychological support. The role of clinical psychologists is managing family conflict. In difficult end of life situation, resources like medical literature, ethics committees, and clinical psychologists play a critical role in providing the guidance needed to make informed decisions that respect the patient's dignity and wishes. And here's the conclusion. The balancing ethics and legal frameworks, ensuring that decisions respect the patient's autonomy while managing family conflict. The role of healthcare professionals. The healthcare professionals must remain neutral, upholding ethical and legal standards. The future consideration. The importance of preparing for end of life decision making through advanced directives. Balancing ethical principles with legal framework is essential in ensuring that decisions are made in the patient's best interest. Clear policies and the involvement of interdisciplinary teams can help resolve complex family conflicts and ensure a dignified decision making process. And here are the references used in this presentation to prepare. These references provide a strong academic foundation for understanding the legal, ethical, and medical frameworks that guide end of life decisions. They offer essential insights to medical, cultural, and legal factors that influence decision making. Thank you.